go ahead and jump into things. I think timely, Shelley's discussion of the COVID call and flu. Sorry, because that's what we're going to talk about today. Not because COVID is over, but just because it's a good time, I think, to assess what prospects are for influenza this year. We have, now pretty much the whole Southern Hemisphere season to potentially guide us and let us know what happened there. So we'll first look at what happened in Australia over this last flu season that's coming to an end. So remember, in the Southern Hemisphere, because the seasons are reversed there, winter is during our summer months, and that's the height of their flu season. So as you can see, they're coming down from where the peak was at the red arrow. But I think important to note that they have had a relatively normal looking flu season. When you look at the several pre-pandemic years, 2017, 18, 19 on there, you can see that the magnitude, at least of influenza-like illness, which is ILI, reported in their sentinel surveillance sites, was relatively similar to the rates of ILI they've seen at other flu seasons. Now, if you look at kind of the light blue arrow down at the bottom, those are the 2020 and 2021 seasons, where especially 2021, you had almost no influenza-like illness activity in their sentinel network, and that's true of how we saw things here in most of the world. If you look at laboratory confirmed, it is also again of equal magnitude of what previous normal influenza seasons have been. And again, looking at that bottom arrow there, you can see there was almost no laboratory confirmed influenza in 2021 in Australia. So where we had a pause really of 2 years in terms of normal seasonal flu activity, at least in the Southern Hemisphere, this was the first year since the COVID pandemic began that we've seen relatively normal seasonal flu activity. The majority of viruses isolated were influenza A, which is typical of a common year. Many of them untyped, but they had a bit more H3 than H1 this past year. And that varies by season. Sometimes seasons are H1 predominant, sometimes seasons are H3 predominant, and that's been particularly true since 2009 when we had the new H1 pandemic. Hospitalizations, you can see again, relatively similar to what have been seen in previous years, but again, flu hospitalizations for 2020 and then particularly 2021, almost non-existent. So remember, for us in 2019-2020 season, COVID hit really after the end of flu season, so it didn't necessarily impact that season for us. And the 2020 flu season for Australia, June, July, August, was really after the advent of COVID, but Australia had relatively low numbers at that time. So it was mostly an aborted season, but not completely. So then looking at New Zealand, just to show that this is not strictly limited to Australia and New Zealand, again, showing relatively normal flu season numbers this year compared to what they've seen in the last couple of years. So now looking at the US, where are we? This is this season really starting from last October up until current. You can see the triangles, and the arrow points to this point in time where we had a bit of a head fake last year. And if you remember, maybe a little later than this time, I think it was in September, late September, early October last year, we discussed the fact that it looked as if we may be having a normal flu year last year. And we did have close to normal, or at least approaching normal influenza-like illness activity in the US. But I think some of that was COVID that was kind of masked as influenza, as the symptom profile for Delta began to change a little bit compared to what had been previously seen. So we saw more ILI activity last year than we had the previous 2 years, but did not necessarily translate into more actual influenza. That was still relatively low rates. So we're starting to creep back up again. As you can see, those triangles here were at week 35, I think. There have been at least some early reports of influenza outbreaks on college campuses, not necessarily unusual. That happens from time to time, but we'll see where those things go. If you look at hospitalizations over the course of the last several years, you can see that I skipped 2020, 21 because there's really no influenza activity there, no hospitalizations. But you can see we've still had pretty low hospitalization rates compared in this past year compared to where we've been historically. So you can see in 2017, 18, that was a larger flu season for older adults, and we had at peak about 3,000 hospitalizations in a week. In 2018, 19, 2019, 20, you can see we got above 1,500 hospitalizations a week at peak. And this year, we've barely gotten above 300 hospitalizations per week. The other thing to note is when you look at where the arrows are, that tells you which week influenza activity peaked. 2017, 18, it was a bit early. It was right around New Year's. 2018, 19, and 2019, 20, a little later than we would normally see. But we are now much later in terms of this. Peak just happened around week 17, 18, which is quite a bit later. So the flu activity has been a bit unusual, but certainly a lot less over the past 2 years than we've normally been used to. Now, obviously, COVID has made up for this, and it's really the replacement of COVID that drove out influenza activity. And I think a couple of things to really take account of in this graph. First of all, if you see that double sine wave in black that goes across kind of the bottom, that tells you what we normally expect to see from influenza and pneumonia mortality. And this varies over time, as you can see, pretty regularly. So we have a peak in the winter and a trough in the summer. And in general, the numbers, as you can see in that red line, stay close to it. We had a pretty high jump in the 2017, 2018 flu season, as you can see there. And then we stuck to that normal curve until COVID hit in early 2020. And then you can see we have had dramatically elevated mortality rates from pneumonia and influenza, and COVID included, since that time. Now, the dark shaded curve is the COVID mortality. So that area under the curve is counted COVID mortality, but the area under the curve under the red line, which is, a good portion of it is white, it is the overall mortality for pneumonia and influenza. And you can see that while it tracks really closely with COVID, there's been a couple of times when COVID mortality seems to significantly underestimate that P&I mortality. And it's never been more true than now. And so the question is where that double arrow is. What's causing that gap? Because it's not flu, right? Because we just showed that our flu activity is still relatively low compared to historical averages. And so I think that the answer is this is just COVID mortality that we're not counting. We've discussed before that we don't always capture COVID hospitalizations and deaths accurately because different states report differently, and there's different criteria used to determine a COVID hospitalization and death. And I think really what this demonstrates is we've had this dramatic increase in P&I mortality. That's pretty well mirrored COVID activity, but on occasion, as you can see in that summer of 2020 wave, for instance, and now we've had dramatic underestimate of COVID mortality. And we've talked about, problems with case ascertainment, both in outpatient and hospital settings as well. Last thing to touch on is pediatric deaths from influenza. As you can see, 2018, 19, 2019, 20, those were relatively normal seasonal influenza seasons. 2019 and 20 was actually a relatively bad year for kids, where we had 199 flu deaths in pediatric patients, so patients under the age of 18 during that season. But amazing to note, if you look at 2020, 21, we had one influenza death in kids for that whole year. In large part, I think because we pushed flu out with COVID activity, but B, we had dramatic interventions at schools where, for most of the end of 2020 and for a good portion of the beginning of the new academic year that began in August of 2020, we had lots of kids who weren't in school or kids who were in hybrid school schedules, and all kids were wearing face masks. And so we dramatically reduced influenza deaths. Those came back a bit last year. But the prospect is that without any interventions now in schools this year, we may be looking at many more. The other thing to note, I think, is again, to push back on all of those folks who talk about COVID is no more dangerous in kids than flu, et cetera, et cetera. And I think we've hopefully debunked that by now. But if you look again, 2019-20 was one of the more severe flu seasons recently for kids, with 199 deaths. This past school year, so from August 1st of 2021 until the end of July, just a month ago, we had 843 COVID deaths in kids over the course of that year. So over 4 times the annual sum of deaths from this current wave of COVID, and again, Delta and the Omicron variants here, those mild variants that we've talked about, over 4 times the mortality from COVID that we normally see, that we've seen in one of the more severe seasonal influenza waves for kids. So again, COVID is not flu. It is much worse, and it's much worse in all age groups, including kids. So that's all I have, and happy to answer any questions. Thanks, Shelley.